January 15th, 2015, when you first came to my
Yeah,
website.
I'm doing some fun stuff. After being a doctor for 30 years, I worked as a physician and obstetrician gynecologist for about 30 years. I walked away from it in 2017, fed up with the whole system. Spent most of my time coding, inputting data. Back in the 80s, you just wrote your notes and you put down an impression and it was no big deal. Trying to get reimbursed if you didn't have the right code to get paid for what you were doing. So I became a direct access physician in 2013, working as a men's sexual health provider. 2 or 3 years, and I got into addiction medicine and functional medicine. I had started doing health coaching for a company in 2015. They had doctors and nurse practitioners that worked there, and I provided them access to my protocols for hormone replacement. In 2017, I'm going to keep doing this health coaching thing. Way more fun. What I've been doing for the last 7 years. I also teach. I got a job at a community college teaching anatomy and physiology. I substitute teach at a high school. So I've just kind of freed up my time.
Way less stressful than delivering babies at 3 in the morning.
The AMA gave health coaching its own code in January of 2020. I tested that code a month after they did it. They give clients a super bill with a health coaching code on it. And if they turn it in, they get reimbursed like 85% of what they pay me. And it doesn't say health coaching. It's a code physicians can use. Other health coaches use it and it works.
I recently did a poll among some physicians that I'm coaching. Out of these three things, what brings you the most joy in your practice? Number one, prescribing meds. Number two, performing procedures. Number three, teaching and educating. 95% of everyone checked number three, teaching and educating. One person checked performing procedures. Nobody checked prescribing meds. Yet that's what we have, a doctor of medicine. That's our diploma. We don't particularly want to be pharmaceutical vending machines, but that's what we've been turned into. A lot of physicians really miss the real reason they went into medicine, which is educating and teaching. And that's what doctor means in Latin, is teacher.
That's
And
right.
how strange that we would have to outsource that now to coaches. You said in the Cleveland Clinic model, the health coach is providing support and answering questions about the treatment plans that licensed physicians have made. Prescriptions are involved. These health coaches like yourself would get information from clients that reach out to you. And if they need physician oversight, their case could be presented to a collaborating physician and a treatment plan established with the physician if prescriptions are needed. If prescriptions aren't involved, the health coach can pretty much take over without physician oversight. Is that correct?
That's exactly what I do. Most of the time, prescriptions are involved because I focus on menopause and andropause. People that are aging and they want to age gracefully. Got people that just want to lose weight, and I teach them how to do that. The vast majority of the time, I'm working with a collaborative physician. I spend probably an hour and a half to 2 hours doing an intake history, then present that. They do a telemedicine conference call with them, usually kind of like what you and I are doing. Right. And then that's how it starts. And I follow up with them, the clients, every 3 months at the minimum. But I hear from them all the time.
They need a cheerleader. They need somebody to check in with for accountability.
Or they have a simple question. I'm a teacher. That's what I was as a physician. I was a teacher. Now I teach full time.
Can't stand the word coaching just because it's so generic. Life coaching, business coaching, executive coaching, leadership coaching, health coaching, relationship, intimacy, career, athletic, burnout coaches, all these things. I can't stand the term burnout. I really think it's more like human rights violations. And the best way to coach people out of that is to get out of your toxic job. I never really framed this as coaching, but now that I have retired my medical license happily after 30 years of practicing medicine last October, I now realize I've been a writing coach. I've been a speaking coach. I've been a trauma recovery coach, pandemic coaching, suicide prevention coaching, business strategy coaching, executive coaching. I was on the executive team of a Wisconsin hospital system for 18 months and did that virtually from Oregon, which I thought was really cool. I just want to share at the onset, there's so many different types of coaching. Obviously, it would be a seamless transition to go from physician to health coaching. There's a little bit of a question in my mind and that other people have asked me, isn't that tenuous territory when you start to get into making individual plans for people and doing SOAP notes if you're not a physician? Every state is different. I would just love to know how you frame what you're doing so that you're not coming up against these medical boards.
Actually not had that issue, but I do SOAP notes, and that my doctors really like the fact that I have that background, that I can provide all the information that they need read before they have a visit with these clients. Health coaching for most states is not a licensable thing as of yet. So I don't really think that my notes are medical records. But when I talk to my doctor, visit back and forth about stuff, and then I create a soap note for the doctor. I'm kind of like a scribe, and I create a soap note that they can sign, and that becomes a legitimate medical record.
Doctor is overseeing you.
I send all of that to my doctors. They read them. I like the fact that they don't really have to create a medical record. It's there for them. And I usually get something like, I agree, or let's do this. And then I just make it happen. So once the decision is made, I am able to make that happen for them. I'm like a super duper medical assistant. Yeah.
Scribe, health coach, a medical assistant, sort of all wrapped up into one.
Cleveland Clinic model was based on medical assistants doing the health coaching. All I'm doing is answering questions and teaching, cheerleading and motivating. I just happen to have a 30-year medical career behind me to do it. Like me teaching at the high school at community college. High school students, about a month ago on Teachers Appreciation Day, they gave me a certificate for the best storyteller teacher at the high school, because I always have a story. Whatever we're talking about, I got a story that's real that I actually lived through and did. Teaching is fun. If you've done this long enough, you've got a story. You can say, okay, here's what we did 25 years ago. Here's how it worked out. So we're going to do the same thing. 15-minute slot on my schedule cost me $57 as an OBGYN. If I was called to the hospital, I mean, it was like a clicking, it was adding up. So I'm chasing this dollar, which isn't why we went to medical school. I don't know that I know anybody that went to medical school so they could make a lot of money. I don't really know that I've ever met somebody like that. For me, it was kind of like, interesting. When I was in high school, my biology teacher showed a video of human childbirth, very vivid, very graphic. I was in the front row. I was fascinated. Everybody else behind me was throwing up in the trash can. I'm like, I want to do that. I actually told my mother when I was 8, I wanted to be a doctor. And that was from watching Marcus Welby, MD, television show. I was 17, I think, when I saw that film about childbirth. And I thought, oh my gosh, this is like the coolest thing ever. I wound up not being that much of an obstetrician. I wound up being a gynecologic surgeon, and specifically a vaginal reconstructive surgeon. I did 5 deliveries a month, but I did 50 surgeries a month. And the only thing that I'm not doing now that I used to be doing was writing prescriptions and doing surgery. Other than that, I'm teaching like I always did. I teach people how to be healthy, how to age gracefully.
This is just teaching.
Yeah, I write a blog.
The physicians that you work with can do telemedicine visits once a year. Some of the doctors will see them in their offices. They live close enough. And then you generate paperwork and transcribe for the doctors. So you're sort of a glorified scribe. They make sure the medicine gets to the pharmacy. One thing that I heard that an orthopedic surgeon did, started hiring family docs as scribes, and the family docs would make more money as scribes for an orthopedic surgeon. Isn't that crazy?
That is crazy, but I get it.
You're sort of doing that model plus cheerleading health coaching on the side. What I tell these doctors who are in my coaching group is that to stay on the right side of the law, because every state is different and some states are very tight about what health coaches are allowed to do. I always say, don't get involved with a soap note. Don't give individual plans. You can give generic information to groups, but if you start going along the lines of a soap note, start calling them patients, start giving individual plans, depending on your state, you could run afoul of the law potential, depending on the mood of the state medical board.
That's true.
Yeah.
I mean, I have not been challenged, but I guess I wouldn't know unless I got challenged.
Right.
So I use the soap note format because I'm comfortable with that. I could do it as an article. I could do it as just like a paragraph and just not put plan.
You don't want to do anything that could be construed as physicianly. You can do cheerleading. You could do scribing. You could do all sorts of things. A woman who she launched a practice for a specific niche of patients and then did a writing retreat with them as a coaching experience. There's absolutely no way you could run afoul with like a writing retreat. Get a group of people. That's a better use of time. If you're finding that you're doing health coaching with a bunch of diabetics, do a group event, a better use of your time. You could still bill 99214 for these group visits if you're a physician. And it definitely shields you from doing those individual soap note assessment and plan.
I have talked about doing a cooking show. I got led to this through a bunch of trauma, but I came out the other end actually having more fun. I don't make the same kind of money, of course.
You have a lot more free time, and time is
a-
worth more than money at a certain age, right?
Absolutely. I enjoy what I do. The clients that I have enjoy learning. Really like it when they contact me and they say, okay, this is what I think needs to happen based on what you've taught me. And they're spot on.
You wrote, the doctors I collaborate with totally get the value of having a health coach. Clients have my cell phone number, so I answer questions, explain, motivate, let them vent. So they have someone with a clinical background they can reach out to. Easier than leaving a phone message at a busy physician office. One of the most frustrating things I hear from people is not being able to get a hold of someone at their doctor's office to ask a simple question or report a symptom or side effect, and I fulfill that niche.
That's right. I hear from somebody every day. I'll get a text or an email with just a simple question. It takes hardly any time to answer the question.
You also shared that you see health coaches from nutrition to wellness to hormones to gut health, and none have a clinical background. They're ordering labs, explaining results, recommending supplements, behavior modifications, essentially practicing medicine without a license. Very intelligent people, you say, that have found a niche that they're good at explaining, usually because they have rectified their own problems and want to help others. Our ideal client is the mini me of us.
Now that I'm 61, I'm almost 62, I kind of understand the issues of an aging person. Yeah, so I started doing that for women as an infertility doctor back in the 90s. So I figured out that these women would come see me from 38 to about 44 years old, and they wanted to have babies. We had to kind of manipulate their hormones. And I noticed, gee, they actually look younger and feel better. So I started doing that for women that didn't want to get pregnant. And that was my niche. Women in their late 30s and through their 40s who are not menopausal, but they have menopausal symptoms. And then I started doing it for men later in my career. Men, they don't want to go to the doctor. And I'm kind of the same way. Unless I need to call an ambulance, I don't go to the doctor, right? And that's the way most men are. But if you can help them sexually be more virile, they're into that. They'll do exactly what you tell them to do. Men are very, very compliant. When a doctor tells them this is what you do, they'll do it. It's amazing. Women, not so much. They want to negotiate.
How you feel about other people who are non-physicians, who have no clinical background, doing health coaching, putting themselves out as experts in nutrition or wellness, ordering lab, and explaining the results and recommending supplements before that? Or do you think that's a little slippery slope?
It's a slippery slope depending on who's doing it. With this movement of physicians, they're trying to figure out, okay, what can I do other than being a physician? I think being a health coach makes perfect sense. You're supposed to be doing all that anyway, but you don't have time as a big box medicine person. And that's why that Cleveland Clinic model is so effective. The health coach is a medical assistant doing pretty much what I'm doing right now in collaboration with a nurse and a physician and maybe a massage therapist. Very well thought out model. It's bigger than mine. I just happened to come up with the idea, and then apparently the Cleveland Clinic had the same idea. I just didn't do it in an office. They're all on the payroll of the Cleveland Clinic, so this would be a corporate model. So they're doing it as a functional medicine model. That's how they wrote their article.
They're allowing their non-physicians to practice medicine in the Cleveland Clinic using a functional medicine sort of coaching model.
Well, that's kind of what it sounds like. It's a team-oriented approach. The head of the model is the physician. Whatever the physician decides as a treatment modality, the rest of the team makes that happen. It's kind of what I'm doing, except I'm one guy.
The cool thing about coaching that I always tell people, and consulting and mentoring, is you can do that across state lines and do whatever you want, really. I'm having a retreat in the next week, trauma recovery for physicians. It's a peer-to-peer support. People are coming from all around the country, and I'm not practicing as a family doc. I'm just facilitating their sharing at a retreat. So I guess that's coaching. The number of people you can help internationally if you have a strong message is just profound.
Oh, absolutely. When I was licensed, I would do consults from around the world. People in China, I've talked to people in Pakistan, Russia, Germany. I wasn't writing prescriptions. I was basically health coaching people, which I can still do without violating anything because I don't have a board hanging over my head.
When is it that you gave up your license?
I let it expire 2018.
I wanted to retire my license October of last year. They asked me, are you sure you don't want to just inactivate it? No, I would like like to retire it effective on October 1st. They wouldn't retire it until I didn't pay my fee. So it was December 31st of last year. And I have been very happy. I feel so liberated to say and do whatever I want. I feel totally uncensored. Before, I would have probably hesitated to say, yes, I will on occasion help somebody with psychedelic. Can't really say that out loud, right? If you have a medical license. On January 16th, 2017, you wrote me, Pamela, after some soul searching on my part, I have decided that I'm going to pursue life coaching for physicians who feel abused, are suicidal, or are undergoing medical board actions and feel helpless.
I did write that. Made the decision in one day. I'm like, I'm not doing this anymore. I threw a duffel bag of clothes in my car and I drove to Columbia, Missouri, stayed with some friends of mine I've known for 40 years. I have not looked back since. I'm not going to stick myself just into a niche. I'm just going to health coach people.
What advice would you have for other physicians who either feel disgusted with their careers, are counting down the days to retirement? I run a suicide helpline. Like, I hear from people who hate their careers, but they have all the diplomas on their wall and all the board certifications, and they're everything a pre-med ever wanted to be, right? Then I hear, I'll get another call from like a medical student who didn't pass step one. Both these people are suicidal. The people who have it all and the people who want what the people who have are also suicidal. I wish they could talk to each other. You know what I mean? They feel that their dreams have been thwarted and stolen from them. The more you've been abused, the more you accept the victimology mindset, the more desperate you can get with this feeling of entrapment. That can lead to suicide. What words of wisdom can you offer the suicidal healers out there?
When I walked away from medicine, I was in bad shape. I didn't reach out to you, but everybody around me thought I was suicidal. I was around my circle of influence that basically lifted me back up, told me what you've been doing already is what you should be doing. You've been a teacher. So go get a job as a teacher. And I just walked in one day and said, hey, I'm an ex-doctor and I would like to teach. Lo and behold, I wound up doing that. I've been doing that for 4 years. And then the high school, I went and signed up as a substitute teacher. It's fun. I was just at graduation on Sunday. I saw a bunch of kids that I knew when they were freshmen walk across the stage, get their diploma. If you don't have a medical license, it's not like your brain fell out of your head. You just have to use a different approach to use the knowledge that you have. Me teaching kids that are going to go to nursing school. I've got a couple of physical therapy students that are in school that I taught. There's always something that you can do with that medical degree that you have, and it doesn't have to be procedures and writing prescriptions and all that. We're teachers. Doctors are teachers, and that's kind of why we went into it. Decided that I was going to be a full-time teacher, and that's what I do.
That is awesome. I couldn't be more happy for you. Another side benefit of being a health coach or a true teacher, you can get mental health care without anyone being up your ass asking you like where you're going. Do you have to fill out any paperwork to be a teacher where they want your record? Did you ever have postpartum depression? Have you ever had anxiety in your life? Do you have to answer any of those questions?
I did not, although I did have to do they had to do an FBI background check to be a substitute teacher. I don't think the college did that. I just applied and I got the job.
It's just so liberating to know, like, hey, if you wanted to see a psychiatrist next week, you wouldn't have to tell anyone about it. You wouldn't feel like you're going to be monitored if you're on psych meds. So if you revealed that you had depression or PTSD, you don't have to worry about having to go to a committee meeting and have to defend yourself.
Right. My community college thing, they don't ask any of that ever. Students enroll and I show up and teach them.
But your mental health is probably better now than it has been in a long time, I would think.
Oh, way better, yeah. Way better.
And the one thing I want to share with people that might be listening to this, because I know they're really concerned about high student loan debt, having $300,000 of student loans and just giving it up to teach doesn't sound like they'll be able to pay it off. So that when you work for the government, state, so maybe a state school or a nonprofit, you can get public service loan forgiveness. I know a nurse practitioner who just couldn't stand like the assembly line, clinic atmosphere, and she gave it all up, and she's a park ranger in Maryland, and she can get your loans paid off because you're working for the state of Maryland.
That's right. That is exactly correct. Working for a nonprofit. All you got to do is do something that is giving to the community, and you can get your student loans forgiven for sure. Entire student loan was $25,000, and I paid it back with one check my first year in practice.
I only had $22,000 of student loans. I went to a state school. I paid it off during residency. I'm pretty frugal. I'm all about freedom.
Even in your darkest hour, the worst night of your soul, there is something ahead of you. And taking your own life just doesn't make sense to me at all. I was down in the doldrums 5 years ago. I'm sitting on a porch looking at the Lake of the Ozarks, talking to Pamela Weibel about how I've reconstructed my life. Doctors are not stupid people. You can't go through medical school and be a stupid person, but we're still all human beings. And so we're subject to the dastardly effects of medical boards and hierarchy and all that. But there's always a way forward. Always, always, always. You do not have to be a doctor to be a healer. I just got hired by GoodRx to be a copywriter, to redo their blog, their website, and rewrite their stuff and update it. I've written for a place called Uversity. I can take my lecture notes from school and my quizzes and my tests, and I can sell them, and I get paid for that. You just got to think outside the box. And I'm talking about the big box of medicine. If I would have known what medicine was going to be like, I would have never done it. Marcus Welby is a fictional character, and nobody practices medicine like Marcus Welby does anymore.
There's a few people that do, but they're having to do it in their own special way and take total autonomy in their own practice and do it maybe with direct pay.
Yeah, you can do it that way.
What income is possible?
I was making $15,000 a month as an addiction medicine doctor. Depending on how busy somebody wanted to be, you probably rejuvenate that amount of income. You would be working and working and working because it takes a lot of time. When you do health coaching stuff, you're basically taking care of all the work that the doctor doesn't have to do. I kind of learned how much my staff did for me by doing it for another doctor. So my doctors, for a client, they're spending maybe 20 minutes a year, and I'm spending hours and hours per year with them. If you were hired as a health coach, and there's companies that will do that, you can probably make $100,000 a year.
If you did group health coaching, you could probably push that income level up because you'd be serving more people per unit hour.
Per unit. That's right.
Yeah.
You could. Yeah. I haven't figured out how to do that.
I'm happy to help you. That's what I do is I help people do group coaching and group visits and group events. I think I was an event planner in a previous lifetime. I'm very attention to detail and very good at pulling off events.